There are a few links to other resources in the slides, so if you want to look up where I cite things or go dig deeper for further information, please feel free to do that. I'll make those available. I'll also end with my contact information in case you have follow-up questions. I am always happy to talk about this. I love participating with AC4C, and I see my role primarily as being the nerdy scientific expert to kind of make that bridge between the scientific world and the real world. So I can go deep into the technical and the jargon and the scientific part, but I want to see that translate into real world action and have an impact here in Iowa. And AC4C has been a great partner to do that. Let's move on to the next slide, please. So I have a few slides here to basically organize my thoughts, and there's a lot to cover here when we talk about alcohol in Iowa. So I'm going to try and hit just some key points, some key things that folks should know. We can always go deeper on each of these points, and I'd be happy to talk more, but I wanted to give you a quick summary, about 10 minutes, and then I'm happy to take any questions or at the end after my colleagues have made their presentation as well. Well, one of the things that I'd like to start with is that alcohol is a really special substance, different than anything else that we produce. Like it says on the title there, it's no ordinary commodity. And one of the aspects of it that's important to remember is this duality, that it's legal, it's widely used. Many of the people who use it can use it in low-risk ways, and it's an important part of a lot of our social, cultural practices, how we mark important life events. And at the same time, we all know that there's a potential for harms, whether it's a single episode of overuse and you're sick the next day. We all know that there's a potential for dependence. We may not know as much the secondary and long-term harms from alcohol, things like the increased risk of car crashes, violence, sexual assault, or the health problems that won't show up until decades later: cognitive decline, increased risk of strokes, cancers, some of the things I'll talk about in a moment. But this is important to keep in mind, that there's both pro-drinking and sort of anti or harms from drinking happening at the same time, so it makes it a really confusing mix. For me as a social scientist, I think this is a really fascinating topic, like how to make sense of something that we all know is important and central and harmful. Next slide. To set the context, just briefly, you've probably heard this, and I know a lot of the folks from AC4C, they know this very well. We are a heavy drinking state in a heavy drinking region. We are, here in Iowa, consistently above the national average for binge drinking among other states. And we are in this cluster of states, for whatever reason, in the sort of upper Midwest, central north region, of very heavy drinking states. And I came from California to Iowa, and when I first came here, I started asking people, why do you think this is? Why are we so pro-drinking here? And the answers I got a lot of times were, well, winters are cold, it's boring, rural areas. But there are lots of other states that have cold winters. Every state has rural areas. Not every state drinks like us. So something's going on here in Iowa and among our neighbors. That we're just a very pro-drinking, very heavy drinking state. Because of this, and this, I wanted to just highlight this report that came out from Iowa Department of Public Health. This is pre-merger. This was a special work group convened in 2019. I was part of the work group. A number of folks from AC4C were also part of the work group. This was convened in recognition of a steadily increasing rate of alcohol-related deaths in Iowa. And this report actually is a really great summary. It pulls together some of the key issues, what the problems are, sort of a profile of the state. The final report was released in 2021. So the work group spent pretty much 2 full years working on this to kind of give a brief, concise summary of the issues. The last point here, though, I do want to highlight that it ends with a recommendation of 6 evidence-based strategies to reduce harms from drinking, to kind of dial it back. This is a message that I like to share with people, that I often talk about, is we will all do better if everybody who does drink just dials it back a little bit. We'll have a tremendous impact if individuals make small changes, but when we aggregate them, when we think about the whole state together, the hundreds of thousands of drinkers together, small individual changes have a huge impact at the state level. And I'll come back around to this, but I'll give you a teaser. The most effective strategies to change that are shaping the context. We have a saying in public health, we like to say, make the healthy choice the easy choice, or the default choice, or shape the environment so that that's the easiest thing to do. Go the healthy route. Now, the second report that you've probably heard about, because it's gotten a lot of publicity in the last few weeks, is the Cancer in Iowa report. This is prepared by colleagues of mine at the Iowa Cancer Registry. I helped with the theme of this year's issue. Every year they have a special theme that they look at related to cancer. And overall, they give a summary of what's happening with cancer in the state, but then they dig into this particular theme. And this year's theme is alcohol-related cancers. Because at the same time that we had seen the steadily increasing rate of deaths related to cancer, or deaths from alcohol, we've also seen steadily increasing rates of alcohol-related cancers. And again, this report has a really good summary, brief, concise, just the key issues of why we're concerned about alcohol-related cancers. So you can probably start piecing the pieces together here, that we're a heavy drinking state, we've seen steadily increasing deaths from alcohol. Oh, we've got steadily rising cancer rates as well, and we know that there's a connection between alcohol and cancer. So, just briefly, I want to drive this home that alcohol is classified as a carcinogen. So this is a substance that is known to cause cancer. And those are two important words, known and cause. So known, there's been tremendous research done on this. It is well established that alcohol causes cancer. This causal relationship is actually really hard to prove in science. So it's something when we can say that there is a causal relationship. You probably heard that phrase that correlation is not causation. Just because things are associated, we can't always puzzle out whether it's a causal relationship. But here it is clear, at least for some cancers. And it has been definitively linked to at least 6 cancers, probably a lot of the ones that you would expect, wherever alcohol comes into contact with the body, from the mouth, through the gut, and out through the body, all of those regions, so throat, stomach, but also female breast cancer. And that's an important one because that's a cancer that is on the rise in alcohol. We also know that the traditional historical gap between men's and women's drinking has been closing. So women are drinking at higher levels, more like men have traditionally drunk. And we don't know what implications that might have for either female breast cancer or other health concerns. The last point here is also important, that most people do not know about this connection between alcohol and cancer. The next slide, please. So the recommendations here, the individual decisions that we hope people will make, the safest choice is not to drink alcohol at all. For all the different harms that might happen, that's the safest choice. If people choose to drink, we recommend that they stay within the dietary guidelines, the recommended limits. They're shown on the screen here. No more than 2 drinks per day for men, no more than 1 drink per day for women. The dietary guidelines are being reviewed right now, and there is a move to change that so that it's no more than 1 drink per day for anybody. We'll see if that actually happens. The last round of revision, a number of folks were pushing for that change, but it didn't happen. But the third and fourth bullet points here on the screen are important to remember, that any reduction in alcohol use is good. Even if people continue to drink, the more that they dial it back, even little steps to dial it back, that is good. And the last bullet here, don't start drinking if you don't already drink. There is no health benefit to drinking. There is this old belief that is still lingering, that's still around, and it originated in some research in the 1980s around red wine and heart benefits. That has pretty much been rejected by the scientific community, and there's now this emerging consensus that there actually is no health benefit. Looking at the balance of potential harms from alcohol and some of the flawed earlier studies, we've pretty much concluded that there's no health benefit.
What do you consider 1 drink or 2 drinks? You're talking a beer, a glass of wine. There's different alcohol.
That's a great question because it does get a little specific depending on beverage type. So it's, I want to say 4 ounces of wine, 8 ounces of standard beer, about 5% alcohol, but we have very high alcohol concentration craft beers now. They're 8, 9, even higher percent alcohol. So one craft beer could actually equal 2 standard beers. I think it's 1.5 ounces of distilled spirits. That, I'll admit, it gets tricky when you start getting into the different beverage types of what's a standard drink. I didn't include that on there, unfortunately, but I can follow up and
No,
send
I'm
those
just
details.
curious, what do you consider a drink?
Yeah.
So it's
It-
0.6 ounces of pure alcohol, right?
Yeah, it's
Which
by
is
the
never,
amount of pure alcohol, but that varies by beverage type, whether it's beer,
Yeah.
wine, spirits, and so on. Yeah.
Thank you.
So it makes a big difference how big the glass is or how big the container is when
Yeah.
you say one drink, you know?
Yeah.
I think, just to raise a point on that, one thing that's important to us is that how children are affected by these messages. And to see the message carved towards 0 alcohol is way better than any alcohol, is so much more effective in managing youth high-risk behavior than say 1 or 2. And that's, that with research is showing that trend, we really hope that takes hold. I think that's really a nice thing to see out of the research.
Yeah. The last thing I'll say is, folks have done a lot of work already recommending strategies. The Community Preventive Services Task Force, this is a group organized by the Centers for Disease Control and Prevention. Their task is to review the scientific evidence about interventions, about action steps, and determine what has a good evidence base, what looks like it's effective, what may not have a sufficient evidence base, where we can't tell yet whether it's helpful or not, or even to rule out things where there's no clear benefit and saying, well, this is not effective, don't waste your time and resources on it. They have a number of different, I put up there, 7 evidence-based strategies to affect the alcohol environment essentially. And as I said before, the most effective strategies focus on changing the context. Some of the things that are most effective are also most challenging to implement, things like price controls. Alcohol, just like tobacco use, is very responsive to economic conditions. So if you raise the excise tax, if you set price controls, people will adjust their drinking and dial it back. And in fact, this is one of the instances where the people most affected by things like increased taxes are the exact folks we want to hit, the heavy, frequent drinkers. They will feel this more than the moderate, low-level drinkers who will have a pretty minimal impact. There are other ways that we can go about this too by determining how many alcohol outlets we want in any particular community. Things like hours of sale, places of sale, compliance checks. In Iowa here, we have one of the highest ratios of compliance officers to licensed outlets among the US. Or the more outlets, fewer compliance officers, that's what I mean. Yeah, the gap is pretty large here. But things like that, and increasing surveillance, monitoring what's happening, not just with consumption patterns, but the after effects, the immediate harms, the delayed harms, and so on. And I think the last slide here I've included just my contact info. Again, I'll share the slides. I've got more description on a webpage biography at the College of Public Health if you want to look up more of my work. My contact information is here. I'm always happy to talk about this, always happy to serve as that bridge between the scientific world and the folks who are taking action. And I think with that, I'll stop it. I will take any questions, or if Cassie want to go on, and we can talk afterwards.
Do you have any questions right now that are fresh in your mind? I'll get this going. Okay.
Since you're in Iowa City, high binge drinking in Iowa City among students.
Yes.
How do you combat that?
Well, we have made, I will say, things have been moving in the right direction. That we are no longer the top party school, and yeah. But yeah, that is a challenge. The university and the downtown district in particular, because that's where it's all concentrated, have been working in partnership for several years, and I've been part of this coalition locally to create alternatives to drinking, to raise awareness that not everybody has to drink, and to combat some of the misperceptions. In some ways, there's this self-perpetuating almost myth that Iowa City's a party school, you have to party when you're here, you have to drink to excess. Not everybody does, but then there's that pressure to feel like you have to go along. So we've been taking this really multi-pronged approach, moving in the right direction. We still have a lot of ways to go. I wouldn't pat myself on the back too soon that we've had success. But we've seen some good movement there.
But you
I
still
would
got this,
also mention, I see a lot of student groups coming forward with like alternative options, like programming around things other than alcohol, just really creative, fun activities, and I've seen more of that.
Yeah.
Like what? What are the alternatives?
So the
gosh, I could-
different student groups will do alternative Friday night events that aren't centered around the bars or drinking.
I mean, I could scroll through my Instagram and look at their, and they just have all these events going on that.
And for a while, we had Unimpaired, the non-alcoholic bar downtown. Unfortunately, that's closed now. But that was great to have an alternative where folks could go out, but they don't have to be in a setting where there's alcohol. A lot of my research focuses on recovery, and that's something I pay attention to a lot. Where do people encounter alcohol? Could that be triggering if you are in recovery? It drives me nuts that I have to reach over a stack of beer to get a banana at Hy-Vee, things like that. But
and as long as you got the song that they got at the University of Iowa, how are you gonna get the university to change that culture? In heaven, there is no beer, I mean.
Leadership is generally on board. I will say the administration is generally on board. I was a little disappointed to see alcohol sales at Kinnick, but they also made some changes to the tailgating that I think was very helpful to keep it in balance. But it's going to be a long-term project.
I kind of smile when I ask that because, that's a big deal for students and, everybody in the building, so.
We have in Eastern Iowa beer sold at Little League games and at high school baseball games. Your thoughts on that? I mean, how can we stop that?
But that's part of, I think, this pro-drinking context. That we are a very pro-drinking state. Why do you need beer at a Little League game?
Exactly.
And it's one of these things that maybe people don't stop to think about that. Like, do we really need alcohol everywhere? And that is one of the things too. Access is never an issue. If we're concerned about underage drinking, it is never a problem to get access to alcohol here. I think those are some of the examples of ways that we might be able to dial it back. But maybe we don't need to provide it every place we gather.
And that is where a community coalition, I'll just say, plug is, can work on those things and help to educate, if you have a coalition that's getting all the different partners together in your community and say, do we really need this at our Little League games? That's the key. Like, a couple of us have really, many of us here have very strong coalitions, but there's not 99 of us here. And a whole bunch of counties do not have a coalition at all to work on this issue. Anyway, we thank you so much.
Thanks very much.
So I'm going to let Cass Dorius, she is not Dr. Sean Dorius. He said he would maybe give her a fake beard, but on Friday he let me know that he's got a good replacement. And so we have the other Dr. Dorius here, and she's going to introduce herself as well as we also have Matt Voss here. So we're so thankful to have you both here from the Public Science Collaborative out of Iowa State. Yay!
Well, it is a pleasure to be here. I am Cass Dorius, not Sean Dorius. So Sean and I have been co-directing and leading the Public Science Collaborative for many years, and a big focus of our work has been around both recovery and the alcohol area here in Iowa. For many of the reasons that Paul talked about, it's such a significant area that needs so much attention. So I'm thrilled to be here, and then I will introduce Matt briefly now because he's going to be doing half of this presentation. Matt was an undergrad here at Iowa State, and look, he hates when I get his whole background, but I'm going to give it to you because I love it. And he comes from a heritage farm, right? Yeah. So his family has been here in Iowa for a long time, and then Matt went on and did his graduate work at Wisconsin in public policy, and he is our public policy rural analyst, and has worked here with legislators for many years before that. So we're glad to have Matt here, and we'll spend some time talking about many of those same recommendations. Now you're going to see many of the same. Oh, I should introduce myself. My training is in sociology and demography. I'm a professor in human development, and currently I'm serving for 2 years as as a senior research scientist at the U.S. Census Bureau. So I have the great pleasure of being the senior advisor to the chief scientist as we're trying to tackle some of these big problems. But my heart is really here in Iowa, and it's with Iowa communities, and what can we do to support our communities to make the changes that they need to be happy and healthy. And with that, I think we'll get started. So the Public Science Collaborative, we work with governments, nonprofits, and communities to support decision making. And our goal is to help improve the lives of individuals, families, and communities. And we purposely formed this at a land-grant institution because we wanted to take the science to the people, which is really the mission of a land-grant institution. As Paul mentioned, we are a high drinking state and a high binge drinking region, and that's true for both adults that you see on this side, as well as youth binge drinking. So this is a problem that starts early and persists over the lifetime of Iowans. Now, Iowa has the second highest binge drinking rate in the U.S. Our heavy drinking rate is above the national average. Our excess alcohol consumption is, and this is a critical one, responsible for 20% of all deaths among 20 to 49-year-olds. Alcohol claims more lives than all other drugs combined. And alcohol-related deaths have been rising over the last decade. So you heard this from Paul, and you'll hear it again from me, that the message, if I could boil down what we're going to say here, is alcohol use is costly, it's deadly, and it's harmful to communities. So we'll back some of this up with some additional information. So not only do we drink a lot here in Iowa, but to give this more context, we rank 50 out of 50 in the belief that binge drinking is harmful. So we're one of the highest rates of drinking, and we're one of the least likely places in the United States to actually think this is a problem. We're 48 out of 50 in states where the number of alcohol policy safeguards are in place. Now, I'm an optimist, so I say, wow, what a lot of opportunity we have here. There are chances to move, and the good news is so many other states have gone out before us in this area. We have a lot of ideas of what works, and so we're going to spend some time talking about some of those components that work today. Again, Paul, I'm loving, we should have planned our talks together. As a human development, we say that scaffolding is important for knowledge. Just keep giving people the same information in new ways to really learn something. So we are scaffolding for you today. This is the number of alcohol outlets per officer agents. So while we have among the fewest enforcement agents per outlets of any state in the US. And that means that while we're drinking a lot, we don't necessarily think it's a problem, and we're not enforcing it so much, those costs don't go away. This is still very costly for Iowans. We have roughly $2.5 billion a year that are paying for all of the harms of alcohol. And one more, and then we'll tell you, talk about those. No, it was me, I jumped ahead. Some of those harms. This is good. Next slide, thank you. And then one other note is that Iowa is the only liquor control state in that high binge drinking region that we talked about. So we actually do have some unique levers here in our state that we can be pulling to be thinking about how do we drive change. So while sometimes it feels a little depressing to work in this area and say, oh my gosh, there's so much cultural resistance, on the other hand, we have more levers at our disposal than many of our partners, and that's very exciting. Okay, so I mentioned that alcohol is costly, and that's costly in terms of lives and in terms of funding. Alcohol consumption increases the risk of cancer, as Paul mentioned, it's very carcinogenic, of liver disease, of fetal alcohol syndrome, of death. The number that always just shocks me, so I'll probably say it a few times, at this healthy age, as a demographer, I think at this healthy age between 20 and 49, that's when people are sort of at their peak health. 1 in 5 people who died during this period died because of an alcohol-related cause. So that is just huge to think about what we're doing to our citizens, our partners, our communities, our friends. Increases the risk of injuries, of violence, including domestic violence, of chronic illness, and of automobile crashes. Now, when I say these things, it's not just that these are general, these are nebulous, these are out there. We've actually done the research here in Iowa, taken 911 calls and then run statistical tests compared to where people actually have alcohol outlet densities and where there are alcohol outlets. And we find there is a statistically significant relationship here in Iowa between those harms we just talked about and Iowa alcohol units. This is not just a general conversation, this is about Iowa where this is happening. So one of the things is we often talk about alcohol as an individual harm, but it's also a community harm. It harms neighborhoods, there are costs in increased noise, disruption, property damage, disorderly conduct. Here are some of the harms that we found in working closely with our law enforcement officers across Iowa. It has safety costs with violent crime, binge and heavy drinking rates, sexually transmitted diseases. It has economic costs, emergency service calls, hospital admissions, lost work productivity, and healthcare related costs. And then those together sort of equal that $2.5 billion a year. We can skip that, we've talked about it, or Paul handled this one really well. And so there's some recommendations to reduce alcohol-related harms. And we're going to spend some time going over these in just a minute, but what I will say is that limiting the number of alcohol outlet densities, so those are all the different places that serve alcohol when they're clustered together tightly, is an evidence-based strategy that the CDC recommends. And it's one of the top recommendations to reduce alcohol-related deaths. So when you say, where do we even start? We want to start with knowing, where do people sell alcohol in Iowa? How tightly clustered are those? And then how can we think about using that as a leverage point to move forward? We can skip this one for time. So this is one of the ways that we're trying to help local communities, is we built this Iowa Alcohol Insights platform, where here on, it's hard to see here, but in green are all the on-premise outlets. So that's if you're going to go to a bar or a club. In blue, those are off-premise outlets. If I'm going to go to the grocery store or a liquor store and buy my alcohol, this is sort of where they exist in Iowa. And we can also drill down to every community in Iowa. And we can look and see within the communities, how do these, the densities of where things are relate to on-premise, off-premise, as well as schools and OWI crashes. And for 6 of our communities, we've worked with partners where we've actually used their 911 calls in order to test this. And we're working with, we've done this with 6, and we're working with 5 more right now. So we're trying to build out across the state the information that communities can use. So here you see some of the clusters of alcohol outlet densities, the X's or crashes over them. And then you can see where the schools are located. So in this example, here are 2 schools located within the alcohol outlet density. This one has 5 schools nearby, 3 within the density. One of the partners we talked to tells a story about the school that she works in. There's not a single classroom window that you can go to that doesn't look out over an alcohol establishment or some place that sells tobacco in the entire school. So these are one of the areas that we're trying to find the quantitative, but that's filled with those qualitative stories too, that this is being sold early and often to kids who have to walk past it on their way to school. And this is one of the reasons we have such an issue in our state.
What happens when we shift it to a per capita number instead of just pure outlet density to the density per capita? Does it show an overemphasis on rural access, or does it stay consistent with that map?
That's a great question. Have we run, we don't provide maps per capita, but we've run it.
Yeah, we don't have the maps, but we've run the correlations using per capita per 10,000 people estimates, and we still find statistically significant relationships with things like calls for service, crashes.
So they're fairly consistent regardless of which way you map it?
They're fairly consistent. I don't know exactly the difference between urban and rural. One thing you do have in rural places with small towns that might have 1 or 2 bars, so it's a little bit difficult to identify the distinctions between this town that has 1 bar versus this other town that has 1 bar.
But I will say, we were really curious. We knew that the science generally said that these alcohol outlet densities impacted all these community harms, but it had never been tested for a rural place. So prior to us mapping this for Iowa, the smallest community that had been mapped was 350,000 people. And so now we've gone in and done it for all of these rural places, and we can say this holds up. It is true, the science is still there even for small communities, and we're seeing it. And with that, I'm going to pass it over to our policy analyst to talk about what can we do to drive change, because we are primed and ready for it here in Iowa.
Yeah, thanks. So we created this policy report, which maybe some of you have seen before. And what we really wanted to do was just go out there, look at the research. A lot of this is based off of the work that the Community Prevention Services Task Force that Paul mentioned did, and other literature out there that shows effective policy options both at the local and state level. So we looked at the Iowa context, and I'm going to dive deeper into a few of these, but I'll just note we have a one-pager over here, a stack of them that just gives a summary of all of them, and then has a link, QR code to the complete report as well. So a lot of the, go back to the previous slide. We'll stay here for a little while. So, a lot of the local policies we looked at are especially focused around the environment. The alcohol densities that Cass mentioned, the environment that Paul mentioned. And one that I want to dive especially deep into is conditional use permits. And conditional use permits are a zoning tool that communities have where essentially a community requires a business to get a permit that has specific regulations, rules, standards that the business has to follow in order to use that land for that specific use. Those permits can be applied to many things, but they can especially be applied in the alcohol context for bars, nightclubs, liquor stores, things like that. And it's a really flexible tool because communities can set their own standards. For instance, a community could consider looking at alcohol advertising and setting a standard for the amount of a storefront that a business is allowed to have that has alcohol advertising, and that might help reduce exposure to youth especially. But there's a lot of flexibility in how communities can set up a conditional use permit. And it's especially relevant right now because the city of Des Moines has a conditional use permit set up for alcohol establishments. And they've used it with some businesses just west of here in the Port Avenue neighborhood. And that conditional use permit ordinance was actually just upheld by the Iowa Supreme Court as of Friday. So Des Moines' ordinance might be sort of modeled for other communities that are interested in this sort of strategy. Another that I want to focus on at the local level is enforcement. Both Cass and Paul mentioned that in Iowa there is a tremendously small amount of statewide alcohol law enforcement officials, so a lot of the enforcement capacity or a lot of the enforcement goes down and gets added to the plate of local police departments, county sheriff's offices. They already have a lot on their plate, but one thing to keep in mind is that things like bar checks, alcohol compliance checks, are proactive. They can help reduce harms in the future and reduce some of those costs to law enforcement in the future. And at the Public Science Collaborative, we also love data. And one thing we're starting to do increasingly is work with local law enforcement with their data. And they have a tremendous capability here to collect data about things like alcohol violations. They can collect place of last drink data for OWIs, and that kind of data can help inform communities on what sort of establishments in town are what we might describe as the problem establishments, the bad apples, the places that are that aren't being very good stewards of community health, safety, and well-being. And then we're at the Capitol, so of course I want to cover state policies a little bit. Of course, we mentioned earlier, limiting days and hours of sale, pretty simple. If you limit the amount of time that people are able to buy alcohol, it does lead to reduced excessive alcohol consumption. Dram shop liability policies are basically where an alcohol establishment can be held liable if they overserve a patron, and then the patron goes on and commits property damage or gets in an accident. The alcohol establishment can be held liable for damages. Iowa has limited dram shop liability. And then maybe the most direct way is those excise taxes minimum unit pricing, things that raise the effective price of alcohol. If you've ever taken an economics course, you know if the price goes up, quantity demand goes down, and it can reduce excessive alcohol consumption. And this is especially notable in Iowa, where the alcohol excise tax has not been raised since the mid-1980s. And because the excise tax is essentially cents per unit of alcohol, rather than a percentage of total price, that means the inflation-adjusted real excise tax has gone down significantly in that time.
And healthcare costs have gone sky high since 1986.
Yes, absolutely.
Yeah.
Go ahead. So just finishing up here, some recommendations. Cass was talking about monitoring alcohol outlet densities. We know from evidence, we know from the literature and our other work in Iowa that alcohol outlet densities, clusters of alcohol establishments are correlated or are related to these harms caused by alcohol. So monitoring those is important for communities. And then empowering communities. Like I mentioned, I know there's been some frustration with sort of the limits of communities in alcohol licensing, but there are other ways, like the conditional use permits that I just mentioned, where communities do have the ability to sort of control the alcohol landscape in their community, and enforcement as well, which is an area that local law enforcement should have to understand that they are sort of the front line for bar checks and things like that. And then explore policy options finally. There are a wide variety of policy options for communities at the state level. Some might work better or worse for one community than another. So hopefully with the policy reports or the menu of options, there might be a good option for your community. And then here we just have contact information, showing who can be here at
Could I ask this, is there a correlation? Have you seen what other states, their use rate or whatever, compared to the hours of sale? I mean, ours are from 6 a.m. to 2 a.m. Let's say other states, somebody's shut that down from 9 a.m. to midnight or whatever. Do you see, is there any numbers on those states of the difference amount of alcohol use?
Yeah, so hours and days of sale, that is one of the one of these strategies that have very strong evidence in the literature.
There's a strong correlation.
Very strong, very strong relationship. I don't remember exactly
That's
the
fine, no.
size of the relationship, but it's been found to be statistically significant. In the policy report, there are links to some of that research as well.
Yeah, I was gonna say, up here is one of the policy reports, and the QR code, you can get more information. And then I put the email on the back. We'd be happy to send you any information on that. There's a lot of good research there.
'Cause it's